So welcome to the 11th of this series on maintaining good mental health in particularly in lockdown. And these are videos based on a book I co-authored a while ago called I'm Not Supposed to Feel Like This, which is often how Christians feel when they have depression, anxiety, and so on. And this isn't supposed to be happening to me, so why is it? And I must do something about it. So there are two videos left, this one and the next one. And this one is a little bit tricky for me because it takes me into an area of professional expertise, which I don't really have any qualifications in. So, but the lady who wrote this book with Chris Williams and I is a lady called Ingrid Witten, who very much is qualified. And so I'm really going to take the things that she says about how we seek and access help for mental health issues. We've dealt a lot with self-help and how you go about changing the way you see things and look at things, problem solving, and all these sorts of things. But nevertheless, it remains the case that for some people there is a need for other help because the condition that they have reached is one wherein you're really not able to help yourself. And it probably ought to be said at this stage that there is generally a kind of a tendency to say I shouldn't need medication. I mean, this is especially so in church. I shouldn't need outside help. After all, I have God on my side, so I shouldn't need help. And this is so this video is based on the chapter. What about psychiatry and other mental health services? It's good, isn't it, to acknowledge that we have a problem. It is true, as Alcoholics Anonymous and Gamblers Anonymous and other folks say, the first step to getting better is often saying, I have a problem. I remember very well a friend in a church whose wife was very clearly suffering from depression, and it was depression at a level where it needed intervention by people who have access to medication and skills that I simply didn't have. And he would always say to his wife, she's very tired today, or she's a bit nervy today, or something like this. And the real problem, she was depressed. And I just kept wanting to say, look, go to the doctor, get some Prozac, and it'll be okay. But we have this thing, we refuse to admit there's a problem, or we minimize the problem and say it's too small. Listen, there is nothing shameful about saying I need help. We have to do it on our own. But imagine you've broken your leg. You've fallen over, you've broken your leg. You're going to say, well, it's okay. I can fix this on my own. A bit of rest. Put my leg up for a while. It'll be fine. Of course you wouldn't. You go to the hospital. You get your leg seated. You get your bone set. You get some plaster put on. And you get the professionals to do it because you can't do it yourself. We are used to this. We have infections. We may well take antibiotics. If you have a headache, you may well take a paracetamol. But there's some reason why we feel that with a mental health issue, we don't go for the medical option. And particularly that's a problem in the Christian world. There's a sort of stigma that's attached to it. And let's be honest, no one wants to be on antidepressants or similar medication. I wouldn't want to be on them. Nobody wants to be on them any more than you want to be taking any tablets. I've just had to start taking tablets for my blood pressure. I hate it. But the chances are that if I don't, I will shorten my life. And I'm enjoying life far too much to want to shorten it. Sometimes you just have to and get on with it. But with mental health, there is a real stigma. We are afraid that we'll turn into zombies, or we'll find many white coats turning up on our doorstep to cart us off to locked units with padded cells. All of those things are absolute nonsense. And even when people become very, very unwell, it's extremely rare where there is radical intervention. And so, if you're having issues with mental health and in spite of your best efforts, it's not going away, treat it like you would a warning light on the dashboard of your car. It's flashing there and it's saying you need help and you need to get it to a garage because it's probably a problem that you can't fix yourself. We respond to warning signals. And so if any of these are true for you and are not going away, you may need to consider asking for professional help. If you feel persistently low or have lost your ability to experience pleasure in things for a period of 2 weeks or more, if you notice many negative thoughts about how you see yourself, your current situation, or the future, if you've started to significantly alter what you do because of how you feel, so you stop doing many of the things that you did do, or if you started taking a lot more alcohol or other unhelpful addictive behavior, particularly, and this is an awful lot more common than most people realize, if you find that you are thinking about suicide, you're getting thoughts about, maybe I should just end it all and so my family doesn't have to put up with this anymore. If you're having those sorts of thoughts, however fleeting they may be, then the chances are that you need help. And unless you to commit suicide, then that is a massive warning signal. And please understand this. If you've reached that sort of point, then you need help. And you need help from people who have the expertise to give you the help that you need, who deal with these sorts of situations all the time. And so if you're getting to that sort of point, although I'm not supposed to feel like this is a book about self-help, a point can be reached where actually you can't do it yourself. And a bit like having a broken leg or a heart attack, there is no fixing it yourself. You need help. You need intervention from people who know what they're doing. And fortunately, especially in the UK, this help is generally there, and it's also free of charge. And so we don't have to pay for our healthcare, and it's there. And there's countless people with massive amounts of training and experience who are willing to help you. So the first thing you to do, if you're reaching this point where you need help, well, pray. Say, God, please help me, but make an appointment, first of all, with your GP. Your GP will want to ask you questions. I know it's like going to see a GP. You know that they're incredibly busy and that they've got a whole string of patients lined up for after you, that they're busy people. And there's a temptation to feel that you're pressurized, that time is limited. So plan what to say. Say what to be able to say what the main problem is, how long you have felt like that, what symptoms you have, what's changed in your life. If there are any practical or relationship difficulties that are part of the problem, things that you have stopped doing, and particularly any unhelpful behaviours, and be honest about any kind of suicidal thoughts that you have. And your GP won't mind. Write them down, these sorts of things down, and take them with you. Your GP will ask you a number of questions, and it is really important to be honest. Your doctor is not too busy to see you. The GPs I know are very frustrated because the people who need their time often don't go because they think their doctor is too busy, and the people that don't really need much help from a GP are the ones who clog up the surgery and the waiting room. Your GP will want to talk to you. Be honest, be truthful, answer the questions, and particularly if you've thought about self-harm at any serious level, be honest and say so. Doctor may actually want to run some blood tests. Take some blood, send you to a nurse who will stick an almost painless needle in your arm, take some blood, and send it off for analysis, because there are some physical things that can help to cause the sorts of feelings you have, things like anemia, particularly things that make you feel tired. Now, what will happen as a result of seeing the doctor? There are various things the doctor may do. May relate you, he may refer you to a different professional who can help you. If your problem is related to something particular, let's take, for instance, bereavement, you may get referred to a bereavement counselling service. You may get referred to a social services practitioner who works with mental health. You may be referred to somebody or a group who deal with addiction problems. You may find yourself in contact with a community mental health team. Often professionals who work with relation to mental health work in teams. There are psychiatric nurses, CPNs, who, in my experience, are brilliant. You might find yourself talking to an occupational therapist. I have a daughter who's an occupational therapist who works with mental health, exactly the situation. And what an occupational therapist will do is to help you to develop practical approaches to managing how you feel and managing your life so that you can carry on living a normal life. You may be referred to a psychologist, a psychiatrist, a social worker who specialise in mental health. I don't be put off by social worker thinking, gosh, I need a social worker. It's only people who are really dysfunctional who need a social worker. There are social workers who work specifically in the area of mental health. And in my experience, I've only known one or two, in my experience, they have been absolutely superb. In fact, all of these people are. In my experience, the people who are drawn to work in the field of mental health are great people who have a real passion to help those who are having problems. So you may be referred to a psychiatrist. A psychiatrist is somebody, listen, it's not, I must be completely nuts, I'm going to see a psychiatrist. Not a bit of it. A psychiatrist is somebody who deals with, as an orthopedic surgeon deals with bits of your bones and your joints and things. A psychiatrist deals with what's going on in your head, much of which has a sort of scientific base. They may use a combination of approaches, and they will understand the kind of feelings that you have. A community psychiatric nurse is somebody who works in the community, who is a nurse who specialises in mental health issues. They are brilliant people and often precisely the sort of people you want. An occupational therapist, a psychologist, social worker, possibly a psychotherapist. A psychotherapist is somebody who deals principally in talking therapies, but is qualified to, as a counsellor, is qualified to have input into your life. Don't go to anybody who calls themselves a counsellor or a psychiatrist. Particularly if you're in the Christian world, it is still the case that a number of Christians will refer to themselves as counsellors because they have done some training as a Christian counsellor. Be very careful. There is an association of Christian counsellors that is very good, but don't go to somebody who simply offers to counsel you. Make sure it is somebody who's accredited, somebody who has the right training, somebody who has appropriate supervision, somebody who is recommended and recognised by the medical profession. A psychotherapist will deal mainly in talking to you, helping you to express what is going on and perhaps where these feelings come from and what's going on in your life. Please forgive my notes. I'm really sniffly today for some reason. I don't quite understand. It's probably pollen, so please excuse that. So you may be referred to one of those groups or your GP very often, particularly in cases of relatively mild depression or anxiety or other mental health matters, will prescribe you some medication. So what sort of treatments might you find yourself taking? Well, the most likely one, the most common thing that you might find yourself doing is taking antidepressants. Antidepressants do what it says on the tin. They combat depression. They work against it. In your brain, there are a whole bunch. I mean, my degree's in theology, so excuse me, generalizing. Your brain works by chemical reactions and electrical charges across things called synapses that make connections. What antidepressants do is they change what goes on inside to dampen down the effects of the chemicals called neurotransmitters that are likely to cause you to feel depressed. And they are very effective. Many antidepressants also help to treat anxiety. There are different sorts of antidepressants. I'm not going to go into the different types there are, other than to say they are very, very effective. There is still in the UK this idea that antidepressants are addictive. People who have taken a number of antidepressants from going back a long way, things like diazepam, that were addictive. They think antidepressants are addictive. These days, they're not. They may have minor side effects. They may affect how you go to the loo and things like that. But generally speaking, antidepressants have very few negative effects on your body. What they will do is they will help you with your feelings. I'm completely a layman, but I put it this way. The way I put it is a bit like this. And if any medical folk watch this and think this is a bad way of putting it, please let me know. But if you have a headache, you take paracetamol. The paracetamol doesn't get rid of the headache. The paracetamol stops you feeling the pain. Once you stop feeling the pain, you are able to relax and unwind. Your body can rest and recover, and the headache will disperse on its own, as I understand it. Antidepressants are not dissimilar. What they do is they suppress the symptoms of depression so that you can recover, so that you can have rest, relaxation, sleep normally, and get your life back on an even keel. And at which point it may be possible for you to come off antidepressants, the antidepressants that you're on. Now, here's the important thing about antidepressants. They take a while to work. Typically, they take 2 to 3 weeks really to get into your system. And this is frustrating. And this is one of the reasons why it's quite important, if you are going to seek medical help, to do so quite early, simply because it's a little bit like an ocean-going liner. You want to turn it round, you need plenty of notice. It takes a long time to turn round. Antidepressants typically take 2 to 3 weeks before they're really having a proper effect on the way you're thinking and feeling. And the other thing to say is that if you take antidepressants that your doctor prescribes, then after 4 or 5 weeks you're feeling better, don't, whatever you do, come off them. Not straight away, not without help, because what will happen is that for a week or two you'll feel fine, because they are working their way out of the system. And then the day will come, and it can happen quite suddenly, going the other way, where you crash and you're back to square one. And then if you start taking them again, you've got another 2 to 3 week wait before they build up in your system. So the way to come off antidepressants is to do so slowly. For instance, if you're taking 1 tablet a day, to take a tablet every other day, to take half a tablet a day, and so on, to halve the dose or halve the frequency with which you take it. And always do that in conjunction with your GP or whoever is looking after you. And please follow their advice. By all means, and it's absolutely appropriate, pray for healing. And people do get completely healed, by God, of things like this. It does happen. By all means, pray for healing, but trust the medication to do its job as well, just as you would with any other medication. Now, it is true that all medication has side effects. So, but modern antidepressants, of which there are a number of varieties and a number of different types, have very few and are generally pretty harmless for everything else. Now, you may find as well, particularly if you haven't been on antidepressants before, and if your doctor puts you on medication, you might find that the particular one she or he puts you on doesn't really work for you. Either it won't make any difference, or it makes you feel unwell in other ways. Give it time to have a proper effect. But the great thing is about medication these days, there are a whole raft of different types. And if one doesn't work for you, another will. You'll have heard of Prozac, which is the most common, I think, still the most common antidepressant, although maybe my information is not up to date. That works for most people, but it just might not work for you, so you might need something different. There's various other things in the book that I'm not going to really get into. So there's antidepressants. There are things called mood stabilizers. So you may have heard of lithium and another one, carbamazepine. If you have the kind of mental health issue where, and this gets off anxiety and depression at least to some extent, if you have a sort of mood that goes like this, it's sometimes called manic depression. You think you can take on the world one day, and the next day you feel suicidal. It really goes like that. What lithium and other mood stabilizers do, they act like a shock absorber on a car. They even out the bumps. So instead of going like this, you have a nice gentle wave. They help to keep you on an even keel. They are phenomenally effective, and they help a great deal. Now, if you, sadly, and I hope, pray for each of you that you don't have this problem. If you find yourself in need of, as it were, stronger intervention, if, for instance, you have major problems with what we might call schizophrenia. It's a scary term to use. Schizophrenia isn't really about split personality. Schizophrenia is when you lose touch with reality. And somebody put it this way: we all like to build castles in the clouds. The schizophrenic goes and lives there. They lose touch with the reality that they that most of us are familiar with. Major tranquilizers can also be used for severe cases of anxiety and depression as well. If you are prescribed those, it will be because you need them. If you find yourself feeling that you're being persecuted, that there's a conspiracy against you, there's a whole everyone's talking about you behind your back, and hopefully it's not true. Most of these things are common to severe forms of depression, things like schizophrenia, paranoia, feeling of there's a global conspiracy to get me. If you ever watched the film A Beautiful Mind, if you haven't watched it, it's a fantastic film. That's a great example of exactly what I mean. You haven't done anything wrong. It's the way your mind is, and you very much need help. I'm really going to say very little more than that. There are extreme forms of treatment for psychiatric disorder, things like electroconvulsive therapy, which is almost never used these days. We really have gone away from the padded cell and the electrodes attached to the brain. Generally speaking, it is about medication, and only in extreme cases are extreme measures taken when all other possibilities have run out. And I don't imagine anybody who's got the capacity to listening to this video will be anywhere near that kind of stage. There are, of course, other treatments as well. This whole book is based on the principle of cognitive behavioral therapy, and that is a talking therapy. It is about the things we've been speaking about understanding thought patterns and behavior, challenging them, and so on. And there are CBT specialists, doctors, psychiatrists who specialize in cognitive behavioral therapy, and they are well able to help when the depression and anxiety is something that will respond to talking therapies. It reaches a point where talking won't work and medication is the only option. But outside of that, and perhaps beyond that, talking therapies like cognitive behavioral therapy, psychodynamic counselling, can help a great deal. If you're offered counselling, can I suggest, if your GP offers you counselling, can I strongly recommend that you take it? It costs an arm and a leg to see a counsellor. They have to train long and hard, and it costs an awful lot of money to become a properly qualified counsellor. If you're offered the services of a counsellor free of charge, I grab it. It's like gold dust. I once had a series of a course of 12 sessions with a psychotherapist counsellor because of some trauma that had happened in my life, and I was offered it free of charge, and it was certainly one of the best things I did. Things like relaxation techniques. There's all sorts of things around about there now. I can say so. Things like yoga. You have to be a little bit careful, particularly if you in the Christian world. A lot of these things are treated with great suspicion. Alternative therapies. Be careful if they're linked to a sort of New Age mysticism. But many of these things are really helpful. I can mention one particular treatment, which is acupuncture. Acupuncture, I don't really understand why acupuncture works, but it does. There's a whole philosophy, there's almost a religion behind it about yin and yang and about grids crossing your body and all sorts of things. I leave the mysticism aside, but I do know that for some people, acupuncture is incredibly effective. My sister, who died recently, had quite significant mental health problems. And the thing that kept her going for many, many years, right up till the end of her life virtually, was acupuncture. That was what helped her with her depression more than anything. And I reached a point where I said, I don't really understand why this works, but it works. So don't rubbish something and rule it out because you don't understand how it might work. You don't necessarily have to understand how something works if it does work. Be prepared to try different things, but do be cautious if there is a whole realm of spirituality, New Age type spirituality that is attached to it. If in doubt about that, talk not simply to a GP, but talk to a Christian leader who you respect, who understands how some of these things might work. So be careful, but do bear in mind that those sorts of options may be helpful. So I think that's, I'm going to end there. That's half an hour's worth. I hope you found some of that useful. And I want to encourage you. You know, the thing about struggling with depression and anxiety, it's a little bit like you ever drive into a really bad rain cloud, you know, and if you do this, I ride a motorbike. My wife wishes I didn't, but I do. I ride a motorbike, and you don't really want to hit a massive load of rain. But you know what it's like? You're driving, and you see yourself driving into rain. And once you get into it, all you can see is rain clouds. You can't see anything else other than a black sky and this stuff coming down. And on a motorbike, that's not an awful lot of fun. And you think, gosh, I can't see anything through here. It's going to be like this for the rest of my journey. But if you keep going, you discover that actually you're only seeing a few miles ahead. And it may only be a relatively short shower. And actually a few miles down the road, you're back in sunlight. Depression and anxiety can be like that. They can feel like they are a really heavy cloud that's come down on you and enveloped you. And you have this feeling that it is always going to be like this. It will never change. And then you sort of you go to your doctor and you're referred to a specialist or you're prescribed antidepressant medication. And you know what you find is that the rain cloud, the dark black clouds actually don't go on forever, and that you will come through them and it will be sunny again. So keep going, be encouraged. I know it can be hard, it can be really difficult when you're struggling with a low mood, but keep going and keep praying. And I'm just going to finish this video with a prayer for you if you've made it to the end. Lord God, I want to pray for every person who's watching this video who is struggling with a low mood, who may have reached the point where they need help from outside. I pray that they'll have the courage to go and see a GP and the courage to follow and take medical advice. I pray that the doctors and others that they see will be people who will be understanding and kind and helpful. I pray, Lord, for the people watching this who feel like they've hit a bank of cloud and it feels as if it's never going to be any different. Lord, for the courage and the strength and the perseverance to keep going, to follow medical advice where it's given, And I pray that some of the folk watching this, listening to this, may know what it is to come through the other side to a much better world and experience than they have now. I pray in Jesus' name. Amen. So thank you for listening. One more to come, which is really for church leaders, but you you might want to listen in on it. How church leaders can help and how sometimes they don't. Thanks for listening. I look forward to seeing you again. Take care. Bless you. Bye-bye.